Well, good morning, everyone. I'd like to welcome everyone to Trio Maryland's March meeting. And I'm glad to see that spring is right around the corner. I'm Marty Marin, and this is my wife, Michelle, and we manage Trio Maryland. And we'd like to welcome everyone here, all our members and guests this morning on this snowy morning, and we appreciate you getting out of bed and crawling to your computer. Today's topic is being done by the National Kidney Foundation, and it's about their patient network. I have some really different news for you. We are not going to be having our traditional Saturday morning meeting in April, but we will be previewing a movie on Wednesday, April 13th. It is called The Burden of Genius, and it is the story about Thomas Starzl, the father of transplantation. The movie's about an hour and a half long, and we hope you all can make it. But before we get started, let me remind you to check out our events page on our website if you're looking for any advance notices for our future meetings. And now I'm going to turn the meeting over to Michelle.
Hi, good morning. It's good to see all your faces. We're very lucky today. Today's guest speaker is Pattie Dash. She's our good friend and a very good friend to Trio Maryland. Pattie is the executive director of the National Kidney Foundation, serving Maryland and Delaware. You probably all know Pattie. She does quite a lot of work for the National Kidney Foundation for our kidney recipients and patients here in our area. So thank you, Pattie. We welcome you for presenting to our group, and we'll now turn the program over to you.
Good morning, everyone. Happy National Kidney Month. I hope that on March the 10th, World Kidney Day, you were all sporting your orange, just as I am this morning. I want to thank Michelle and Marty and Trio for having me today. It's always fun to be here. I really wish we were back in person because I miss seeing everyone. I miss being able to interact with folks, but I'm really excited to be here this morning. I'm always happy to do something in March. I will tell you that last week on World Kidney Day, we were able to work with one of the pharmaceuticals, Otstica, in 2 locations to put together 750 care packages for patients on dialysis. I just think that is incredible. That is one of our largest events that we've done. On average, we typically do 200 to 400 per donor that will do that for us. So that was great. We did a legislative briefing that evening. We had a diabetes and kidney disease talk that day. So we were pretty busy on World Kidney Day. So I will plug that if you're not following us on Facebook or other social media channels to do so, you typically can find us by NKFMDDE. Please like, follow, share, because we put a lot of great information out there. So before I start my presentation, 2 of your friends that are 2 of my other good friends are Mr. and Mrs. Chiat. I don't think they need any introduction, but the 2 of them do sit on our Maryland Kidney Walk Committee and do a lot of things for the National Kidney Foundation. I know that they would like to talk to you a moment about an upcoming event that we have. Eileen, Jerry?
Well, good morning. Thank you, Pattie.
Good morning, everyone.
Hope everyone is well. Happy Zooming to everybody. Wanted to let you know we're going to have a walk this year. And we're actually going to be seeing people this year rather than electronically. So please note the date. It's going to be October 23rd. It's going to be at University of Maryland, Baltimore County. And we are encouraging everyone to walk, to help raise funds, because you know the funds are used for various reasons with the Kidney Foundation. And so it's October 23rd. It's our 20th annual walk. And if you want information, you can go to www.kidneywalk.org. And we're also encouraging anyone who wants to be a volunteer. We will need volunteers, whether it be collecting money or cheering the walkers on or doing all kinds of wonderful things to help the Kidney Foundation. So October
Thank you.
23rd.
Thank you, Jerry.
You're
Our
welcome.
walk site doesn't open until April 1st, so you'll hear more about that. But we hope to see you there, and we hope to see our trio friends with a booth again in our health tent, because we are just, I shouldn't say the word dying, but we are dying to get out and to be with everyone again. So, all right, without further ado, I have two presentations that I'm going to be doing with you today. I want to start the first one that is about our legislative priorities that we shared the other day with our legislators, as well as share a little bit of other news about Maryland and stats. Can everyone see my screen okay?
What?
Wonderful, wonderful. So again, happy National Kidney Month. It's one of my favorite times of the year, and just love being able to get out and see everyone. So the slide that you see in front of you now, I'm just going to give you some Maryland statistics and updates. So chronic kidney disease, as you know, impacts 37 million adults. And 90% of those people do not know that they have it. And that's why the National Kidney Foundation is out across the country trying to raise awareness and education around kidney disease. We also know that kidney disease has two leading causes, one being diabetes and the other being high blood pressure. So when combined, you're at a higher risk. And if it's not treated, you're at an even higher risk. We also have racial disparities that happen through chronic kidney disease. African Americans are 4 times more likely to be impacted by chronic kidney disease, as Hispanics are 1.3, Asians 1.4, Native Americans 1.4. They're all more likely than Caucasians to have CKD. So we've been working a lot, and we will be showing and demonstrating in our coming year, when our fiscal year starts on April 1st, how we as the National Kidney Foundation are going to continue to pull down those barriers for people of color and people across the country to help us knock out kidney disease. When I first started with the National Kidney Foundation almost 7 years ago, there were 26 million people impacted. It then went to 30, and we're now at 37. We're not going in a direction that I would like. I've often told people I would love to put ourselves out of business, but I don't see that happening at the rate things are climbing. So average annual cost to Medicare, this is an important piece to keep in mind. Pre-kidney failure, that cost is roughly $23,500,000. Dialysis patients represent $90,323 per patient for their dialysis treatment. Transplant after the first year is almost $26,000 per patient per year. So you can see that with 37 million adults having CKD and 90% of them not knowing that they have it, that the cost of Medicare continues to rise. So where we had 120 billion, it is now $153 billion that Medicare spends on kidney patients. I would think each of you would agree with me that something has to change. In Maryland, you see our little state over there represented in the orange. 92,920 Medicare patients are diagnosed with CKD. Now, I want to point out that these numbers that I'm sharing are Medicare patients. That doesn't include folks who are not on Medicare. So, for example, when we talk about Medicare patients on dialysis, while there says 9,378 patients are impacted, it's really more like 12,000 here in the state of Maryland. 2,094 kidney patients are on the transplant wait list. 360 transplants occurred in 2020. The sad news is that there was 135 patients who died while they were on the transplant wait list. This is why it's important to me that we share that we're doing a Big Ask, Big Give Living Donor Workshop again in partnership with the University of Maryland. Marty and Michelle will be sending out the invite for that, and we hope that if you or anyone you know are looking for a living donor, that you'll attend this free virtual workshop to learn more and to advocate for living kidney donation. Now, in every year, the National Kidney Foundation works with the Congress on legislative priorities. And we just had a successful kidney patient summit earlier this month, where we had over 220 people represented across the country speaking with legislators in their own states. We in Maryland and Delaware did the same and had volunteers like you helping to tell your story and to talk about the importance of our legislative priorities. Now, while this is a lot of information, I'm going to hit the highlights of it. At any point in time, you can always visit kidney.org and you can search for advocacy and you'll see all of this information. You can download our priorities and read the briefs in full. I'm sure you know if you've been involved with legislative priorities, it's pretty extensive, right? So the first priority for us is to remove barriers to living donation and organ transplantation to make transplants more available. We can say check to that one, and I'll speak to that in a few moments. The second priority is expand access to home dialysis to ensure all patients are given the chance to succeed on this modality so they choose. And then, of course, the third is about increasing funding for kidney disease awareness. As we keep going back to the 37 million people who are impacted and 90% of them not knowing, this is even more important. So I said we could check off number one. Well, you all probably know that Delegate Lukey actually was the one who introduced the bill for the Living Donor Protection Act that got passed in 2019. He was one of the delegates on our legislative briefing the other night, so we gave him a huge thank you for all that he has done to help us ensure that the Living Donor Protection Act was passed here in Maryland. We talked about the improving access to home dialysis, and I do think that this is something that is extremely important. Now, I didn't go over a lot with regards to the Living Donor Protection Act because I do believe you all know more about that since it's been out. But of course, you can put into your chat box any questions you might have a little bit later. But when it comes to improving access to home dialysis, improving that access, it is an act. It is HR 5426. There's no Senate bill yet, but we are looking for that to happen anytime now. Home dialysis improves patients' outcomes and quality of life, yet it's underutilized in the U.S., not just here in Maryland, but in the U.S. This bill would expand Medicare coverage to pay trained staff to assist patients with their home dialysis needs. These staff would serve as that bridge for the initial period to help patients get comfortable doing dialysis at home. The bill also provides for a study of racial disparities in home dialysis and calls for the creation of a patient quality of life metric for all dialysis patients. More than 550,000 patients are on dialysis nationwide. 85% of them travel to a dialysis center in their neighborhood. However, only 13% use home dialysis. We hope that when you hear more about this and when you see the opportunity to weigh in, that you will also visit kidney.org and use our opportunities there to sign up to share your voice with our new Voices platform, which you will see shortly. Now, I think that everybody would probably agree that if you did dialysis at home, it could be better for your body, it could be better for your overall mental health, it could be better for just in general that quality of life at home. So we do hope that we will see that number grow from that 13% up even higher. Now, this is a big one. Now, we've made an awful big ask to Congress about priority 3 to increase funding for kidney disease awareness and research. This is critical. We can't do the work that we do if we don't have the money allocated for it. So basically, in a nutshell, you can see in front of you that with more than 37 million Americans that have CKD, including nearly 750,000 with irreversible kidney failure, another 80 million at risk for developing kidney disease through the risk factors we identified earlier, 90% of them not having been diagnosed and not knowing, and that Medicare currently spending 25% of its budget treating that disease, yet federal funding for kidney disease research is lagged. If we don't do something to address kidney disease upstream and slow or stop the progression of kidney failure, we could have over 1 million patients in kidney failure by the year 2030. That is staggering to me, and I would hope that you too would want to lend your voice about this. So again, if all of this happens and we don't intervene and we're not able to get the $15 million that we're asking for, the cost of treating these patients could bankrupt the Medicare Trust Fund. That would not put us in a good position at all, now would it? So I just want to say that as we are in National Kidney Month and we are in a position where we want to raise that awareness, you can help. You can help by helping us spread the word through social media. Again, if you like and follow us, you can easily share it, or by using the information that we send to Marty and Michelle. You can be part of the Are You the 33% campaign. It's a digital campaign focused on reaching and educating and empowering people of color, people of other races and ethnicities to help control their kidney health. Our outreach strategies and audience targeting these key messages are very easy to follow. I'll send the link for the toolkit where we have social media messaging that's already, all you have to do is copy and paste it to Facebook, Instagram, Twitter, LinkedIn, but you'll be able to take a risk. So you see a risk quiz. If you see that minuteforyourkidneys.org on the phone that's being held on the screen, that's where you'll send people. They'll be able to take a risk assessment. It'll come back and give them questions that they can use for their doctor visits, and hopefully they could start having a conversation about their kidney health with their primary care physician before it becomes too late. So I want to stop for a moment because I've given you a lot of information here. And I just want to see if there are any questions. I think I can put that link for you for the kidney risk quiz, because then you could just pick that right on up from it. But I'll show that to you again for a second here. Just bear with me. Let me put that in the chat for you. You can share that with anybody, like I said. I think it's important that people do know what their risk factors are. So you'll see this screen here, and it'll say that you're answering it for yourself or a loved one, and you start the quiz. And once you do that, you answer those questions, and it'll just come back and give you the answers to that quiz. So again, I would basically ask that you please do help us spread the word and take a minute for your kidneys. It could save your life. After a couple years of working with nephrologists, patients, other caregivers, and such, the National Kidney Foundation put together this new patient network. Now, there's a QR code up there. You can hit that if you'd like. It'll take you right to the page that we'll be talking about. And it's done in conjunction with the Pulse Info Frame. So one thing that we're always asked to note that this is definitely a very HIPAA compliant, a very secure database that's capturing patient information. So please don't be afraid that you're going to have any issues when it comes to your data being secure and safe. So they do ask us to share that. So the National Kidney Foundation launched this patient network. It is the first of a kind. It's going on over a year of being in existence. And it is for, as I said, that nationwide kidney disease patient registry. So it links patient entered data with clinical data from the EHR, electronic health record system. And it's the beauty of it is everything is online, it's easy to access. And so you're going to learn a little bit more about that today. So again, the user-friendly and secure network collects both vigorous and clinical and laboratory data from that EHR that I mentioned, in addition to patient-entered data, which together allows for a complete picture of your patient's experience. This model is an innovative, and it's the most with research initiatives followed from one path to another. The EHR, or patient self-reporting system, is basically one of a kind, as I had mentioned. So the participation is free, it's accessible 24/7, and like I said, it's easy for you to be able to access. So what is it? Again, it's the first online registry. That screenshot is a little bit of what you see when you go into the dashboard. So as you can see, this is something being used across the country and across the world. They're working to that, but right now it's into the United States. And the overall goal of the registry is just to improve lives of people with kidney disease. And so how do they do it? They do it in that safe and secure online portal that we just discussed. It's easy to log into. You get a username and a password, and you just move forward, and it's pretty easy to use, as I mentioned. So it allows you to have access to a one-stop shop for kidney resources that enhance care with individualized education, tips, and support. Be part of a research and make a positive impact on treatment development by participating in the studies that they offer. Easily enter health data and connect to similar patients. So it's kind of a little bit like our peers program, where you can talk to someone who perhaps is on dialysis or what have you, but this is modified. It's even more powerful and gives you more access. And you can be part of a supportive community that understands what it's like to live with kidney disease. I like the fact that the network focuses on the diversity of a patient population with kidney disease and collects observations that can inform the development of patient-centered research, care, and treatment. Now we're going to watch a brief video.
Welcome to the NKF Patient Network, a new patient portal by the National Kidney Foundation, which has been created specifically to help people with kidney disease keep up with the latest research findings and help find out if a cutting-edge research trial is right for you. This powerful research tool is helping to transform kidney care and research together. You may have recently been told by your doctor that you have kidney disease, but please do not worry, you're not alone. In fact, more than 1 in 7 Americans have kidney disease, nearly 1 in 3 are at risk for developing it, and over 700,000 people have disease that is severe enough to affect the ability of the kidneys to work well. At the National Kidney Foundation, we're a group of health and wellness experts who are here to help. Working with our patient advocates, we've developed this new portal with you in mind. We would like to walk you through the ABCs of this site. A is for actionable, personalized information. Many of you have told us that you're interested in learning more about the cause of kidney disease and what you can do to improve your kidney function or quality of life. Because of this, we have actionable and personalized information that can help you, no matter how advanced your disease is, whether you've recently been diagnosed with early-stage kidney disease, are on dialysis, or have received a kidney transplant. B is for the concept of bringing to light. This is another very important thing that our portal does. Because a critical part of bringing something to light is making sure that it is proven by strong research, we connect you to research that is being conducted by prominent doctors around the country. Medical research is so important because it's the way that doctors around the world know which medicines to use for kidney disease, how to treat people at different stages of kidney disease, and which lifestyle changes to recommend. With our portal, you not only learn about the latest scientific discoveries that might help you manage your kidney disease, but get a chance to participate in research studies that might directly help you or may benefit other patients. Think of us as your one-stop shop for getting involved in and learning from cutting-edge kidney disease research. C is for current. And when I say current, I'm referring to real-time data. One thing that really helps doctors is understanding how thousands of patients with kidney disease are doing in the real world in real time. By contributing to this platform, you and other patients with kidney disease can help doctors around the country and the world get better information that can help them understand what is happening on the ground in real time. So, for instance, if we need to know how people with kidney disease are doing in the pandemic, and 10,000 patients like you respond to our survey, doctors will quickly understand what is happening in the real world and develop quick solutions to improve care. We really hope that you become part of our community, as we want the best for you as someone living with kidney disease. Together, we can transform kidney care, research, and ultimately find a cure for kidney disease. As a next step, please click the button below to register today.
You'll get that link that you can click on too, but like I said, there's also the QR code that's available. Okay. So as we were going through the video, if there were questions that you might have, please do put them in the chat. Like I said, here's the QR code if you'd like to click on it, shoot your phone at that so that you can get right to the network to sign up. And as the presenter was saying, that by everyone participating, we're getting a lot of information that can make change in the future with research. So who's eligible for it? Adults aged 18 and older, those diagnosis of kidney disease of all stages and types, and that are English speaking at this moment. This network will be expanded and just grow year over year. The education is that one-stop shop that we spoke of with kidney resources that can enhance the care for individuals, gives you tips, support. It's really pretty neat. I've seen a couple of the demonstrations of it, and it's pretty neat to be part of. That research piece, I think we all would agree, is critical. We need to accelerate that research to focus on patients' outcomes so that there are priorities and actions happening. And then, of course, the treatment of advanced clinical trial planning and implementation. Research is what drives the chain of what's happening here with kidney disease. So we want to make sure that all of these things are working hand in hand. So this is at a glance for you to be able to see the benefits of joining, who can join, and to where to learn more. So as we've discussed, it's going to improve that care and treatment. Individuals receive the resources that they need and want. They can be part of clinical trials. I told you what the parameters were for age and English speaking, and that they're willing to complete the platform information and give that consent. Once you give consent, you're in, and it starts working for you right away. So if you don't use the the QR code that's up on your screen, you can visit nkfpatientnetwork.org. That's where you'll find all the facts and frequently asked questions and videos and patient testimonials. There's also our NKF Cares helpline that maybe you know about that you can call. The number is on the screen. They are available Monday through Friday from 9 to 7. You can also email nkfcares@kidney.org. And we also have an online communities portal where you can just go and add your posts and chat there with folks. There's a new section for teenagers, which is kind of neat. We've been working with a couple of teenagers recently and found that here locally and found that they had questions, but they didn't want to call and talk to anybody. So going online made it easier for them to ask their questions and feel like they were being heard and respected. This is the dashboard. If you see when you log into the patient network, you have your dashboard, you have your library, you have your profile. And so this is just that opening page to show you the information. So pretty easy once you're logged in. You can start the survey and complete your information, access the network in that manner. We've had it demoed to us as staff many times here in the past, year. So it seems pretty, easy to use. One of the things as of January of this year, they wanted to share some of the numbers from the network. So we have over 1,230 now consented participants from 47 states across the country. There was one study site, Geislinger Health System, which is one of our main partners, did with 19% participation out of that 1,230 number, so 232 people. One rare kidney disease group partner, Alport Syndrome Foundation. One central IRB in the US, Tufts Medical Center. One central IRB in Canada, University that was there. One selected data coordinating center, Tufts Medical Center. So you could see we've got some big players behind the scenes with this and working and partnering with us. And so as I mentioned, there are a variety of ways that you can find out more about the network and check it out and see if you're interested in yourself or someone you know who might be interested. And so I just mentioned some of those partners, but some of the others are Bayer, AstraZeneca, LabCorp. And so we're really excited because this is again one of a time type thing, one of a kind type thing that has been offered, for the National Kidney Foundation. So with that said, I wanted to just give you that brief overview of the actual network to see if this is something, is anyone currently on the network? With anybody that's currently on it? Um, does this sound interesting? We're trying to test the waters here with folks locally. Does this seem like something you could do a thumbs up or something that would be of interest to you? Thank you. Thank you. Okay. Oh, I see more. Okay, that's good. All right. Are there any immediate questions that you might have? I think I saw one in the chat. Well, one was for you, Marty, and Michelle. When is the movie in April? Oh, I see you answered that. Okay, thank you. And I put that risk quiz for you there. Okay. Once you've been transplanted, are you still considered a kidney disease patient? Well, I'm not a doctor and I'm not allowed to give medical advice, but once you're impacted with kidney disease, you are a kidney patient, right? Because there are many times that, maybe some of you even have. I have patients that have had 3 and 4 kidney transplants. So once your kidney fails, you're back on the transplant list or you're getting that kidney transplant. So the answer to that would be yes, but as with everything, you need to talk with your doctor. A question here was, I was on peritoneal dialysis before receiving a kidney transplant in January 2021. I had received my monthly supplement shipment right before the transplant, so had a lot of supplies left. It took a lot of work to find a way to donate them. No one I asked would take them in the US. I was consistently told, throw them out. I found this very unsettling. I was finally able to figure out a way with lots of donated assistance to have the supplies shipped to a charity in Jamaica. So, this is one of those things we get phone calls all the time about where people would like to donate their supplies. Unfortunately, because there is that whole chain of command, right? You've got the materials, the supplies. No one wants to really take them open, non-open. If they're open, of course they won't, but even unopened. It's unfortunate, but what we have found is that by calling some of the dialysis centers directly, they will put out a message to their patients, and they will say, if you're interested, to contact. And I have had people be able to do that in that way. So if you're in that position, perhaps contact a DaVita Fresenius, or other donation site, another location in your area. But thank you for all your hard work for trying to do that, because somebody's, I'm sure, really benefited from that. If one has kidney disease or kidney failure, can you give a list of foods that can be eaten and foods to avoid? Absolutely. So on March the 29th, Marty and Michelle are going to be sharing with you a patient event that we have coming up that is all about nutrition. It's in collaboration with Horizon Therapeutics. We have a dietitian. She can send you that invite out as well. But if you follow us on Facebook, for example, too, you'll see it there as one of our events. It is a free virtual program. It's being done between my market for Maryland and Delaware and the Pittsburgh office. And so we're going to be doing a series of these pretty much quarterly that are on different topics. So at any time that you think there's a topic you would love to see us do, you can email me or one of my team members, but you can email me and I can get it to them. Pattie, Pattie, @ kidney.org, and I'll put that in the chat for you. But we're, just kicking this off and we're so excited about it. But this one is all on nutrition, so you probably will want to see that. You can also go to our website and you can search for our recipes and other things there. Yes, there is a list of foods that you should avoid, etc. So any of those things, if you don't find it, just let me know and I'll happily send those links along as well.
Thank you so much, Pattie. I tell you, all the things that the National Kidney Foundation is doing and all the resources that you offer and make available so easily, it's just unbelievable. It's really good to get that information out here. I'm glad you were here today to be able to do that.
I'm sorry, I hope they can cut out my little faux pas with my technology difficulty there. I tell you.
Well, I think that's what makes these things interesting, and then to have those little tweaks. We've certainly had those ourselves, but are there any other questions now here at the end before we lose Patty? You have the person that can pretty much answer anything here regarding the Kidney Foundation.
I'm just going to share that patient invite on my screen here for a second too. So this one is making healthy lifestyle choices with CKD. Again, it's free and it's virtual. There's a QR code if you want to snap that. And we have Dr. Geisler, who will be with us that day, that evening, as well as Heather Lash, and Timmy Nelson will be sharing his personal story. So it is at 6 o'clock. It's an hour-long virtual webinar. And again, if you want to join us, please register here.
Thank you, Patty. This has been great. We appreciate your time and all the information you've provided today. This PowerPoint deck is already on our website. And as I said, I will be sending out the link to this recording, plus all the additional information that Patty spoke to in an email, probably in about a week. It is an email that comes with an Eventbrite heading. So it's through their program that it gets sent out. So look for that in about a week.
And we'd like to thank everyone for attending the meeting today. We love seeing everyone on the Saturday morning. The one thing I did want to reiterate before we hang up here today is once again, we will not be having our traditional Saturday morning April meeting. We are going to be moving it to Wednesday evening, April 13th. And for those who have not heard of Dr. Starzl or the Burden of Genius, I think it'd be worth your adventure to take a look, punch it into Google today. You're going to find the story of Thomas Starzl is quite interesting. And you'll be quite shocked to learn that the first liver transplant was only done in 1967. So it's not like it has a 100-year history behind it. But it is a movie that we are renting from Hollywood. It will be of no charge to you. It will be free and open to the public. So we encourage you all to attend if you can. The other thing I want to remind you is check out our website, www.triomaryland.org. You will see all these sessions on our speaker notes page, along with the speaker notes. We appreciate you taking a look at it. And don't forget, we have that live YouTube channel going nowadays. We like to wish everyone a safe and healthy weekend. Patty, anything to say before you leave?
Just thank you for having me. Please stay healthy, stay safe, stay warm, and let us know if there's anything we can do for you.
Great. And Jerry and Eileen, I want to thank you very much for all that you do for the Kidney Foundation. They are very active. So if you have any questions and need to talk to them about upcoming events, you can get in touch with them through us. So please just drop us a note. And at that point, I think that'll clear it up for the morning. We appreciate everyone coming. We can't wait to see you next month at the Starzl showing of the movie. And have a great weekend, everyone.